All right, you all. So, welcome to another episode of Healthy Chats. Of course, I'm your girl, Carlika Katrina Bass Knight-Munndez. I couldn't even type all of that out because I don't know what letters you may or may not see. But nevertheless, on today, we have Dr. Yamina. She is with us, and I might even said that wrong, but she will, we're going to go with the last name, Cortez, right? But she will correct me as well. And so, you all know we like to bring positive energy, positive news, and positive information that highlights so many women and men with in various areas, right? Not just in my local community, but all over, because she is not my next door neighbor, right? But we met in Washington, D.C. with the Society for Women's Health and Research at a menopause round table, and her insights and everything. And I was like, man, I need to connect with her after this so that we can just have information and have a great conversation with her. So Dr. Cortez, welcome, welcome, welcome.
Hi, thank you for having me. Yes, my name is Yamina Cortes. So you were little, but it was good. It was good.
I was off, y'all. Your girl was off. So just introduce yourself, let people know where you are, what you do, and then we're just going to hop into a great girlfriend chat.
Okay, so I am currently in Iowa. I work for the University of Iowa College of Nursing. I'm an associate professor, so I mostly do research, and then my research involves menopause, midlife women's health, cardiovascular disease, and also trying to tailor menopause education, more culturally tailored education. And I've been here now for about 2 years. Before that, I was in North Carolina, and then I'm originally a New Yorker. I don't know if you wanted all that information, but
Absolutely. Look, we're getting in her business just a little bit, okay? And I love that. And so I love you said something, menopause education. And so even with that aspect, right, what made you say, hey, there's a need, there needs to be more awareness initiatives, and let us know some of the things that you are doing or have done.
so I think in general, we see that women are always looking for education about menopause, and may not always find the sources that are culturally tailored or comprehensive for them. So for me, for example, I grew up translating for my mom at different healthcare visits. So I knew just going through that and then starting, in undergraduate and then graduate school, that there was a need for more Spanish language education in general in healthcare, but then specifically as I got into the menopause world, just more information in Spanish, but then also just for different perspectives, like culturally
Mhm.
tailored information, health literacy wise, also literature level information, examples, as much as possible that are necessary.
And I love that because a lot of times people, we may not even think about certain barriers in healthcare, whether that may be a language barrier and not, and you would think in this day and time, right? All of this would be more prevalent, more accessible for people. And so when you think of, just you mentioned even the language barrier, what other barriers or what other things do you see culturally or even within the healthcare facet, whether that's menopause or anything, or going to those visits with your mom and having to translate in different things? One, how did that make you are, make people feel, number one? And then two, do you feel like the level of care is giving as it may possibly be for another culture or anyone else?
Yeah, I think one of the issues, and of course, like now we see, hopefully, things are a bit better in terms of having more access to actual interpreters and interpreting services at healthcare visits. A lot of the times, and then growing up, when you go to primary care, and they want a quick translation or quick information, we still see that there are children that are translating for their parents, and you know I am a child, or we're kids a lot of the times, and you don't understand exactly the medical terms. You don't understand in English or Spanish. And so there's a lot that's going to be lost in translation. And so that's one of the things that you want to try to steer away from that because, and even when you don't have someone who is a licensed medical interpreter still interpreting, a lot of things can be lost in translation in terms of information going from either direction. There are a lot of things that then the patient won't grasp or understand, that the provider also won't understand in terms of like what questions to ask, what information is accurate enough to really give people the personalized care that they need. And then I mean, I think growing up, because I saw a lot of my friends also in the same situation, I didn't notice until I was older that that was not how things were done.
Right.
But yeah, of course it's going to affect the level of care.
Absolutely. And I can only imagine because I think of even with myself, right? And myself and the provider speaking very clear English, right? The
Yes.
misinterpretation, the misinformation, or not being heard, or certain things, even being gaslighted or different things. And then you think about how can I receive? How can you even give me the proper care plan, or how can we come up with a decision if you don't understand me, right? And now both parties are possibly getting aggravated, right?
There's
And
also like the time limit on top of that. So then that's also why like you're feeling rushed or they're feeling rushed too because of the time limit that you have to share and ask all the questions that you have. And
right.
yeah.
So I mean, it's so evident that there's a great possibility, like the proper care that I or myself may actually need could be just missed altogether, especially when we're thinking of this is my body and I'm here to make an informed decision with you, right? But if I don't understand you or I didn't understand something, and so even when my mom's at the doctors and different things, I'm like, no, speak in the lamest terms, okay? Because everyone's not in the medical profession. We don't know all of the lingo, the terminology, the abbreviations. So speak in a way that patients will grasp the information. I often, even talking about menopause, no, let's break it down so that a fifth grader or someone can understand it, and not demeaning someone's intellect or anything. Just saying, look, let's break this down in the simplest terms possible, so that we can come up with a care plan that's going to be feasible. And so even in this space of, you mentioned about research, what does that look like for you? Like, what type of research and things do you do?
So a lot of my work is primarily about cardiovascular health and the changes that occur during the menopause transition. And so I look at different factors across life that impact, because it's not just, yes, we're going through changes during the menopause transition, but then there are all these things that preceded that, all these things that came before that still impacted. So what happened, whether or not you became pregnant, and what happened during that pregnancy, what are financial status, education, stress, and different levels of stress that you've experienced across life, and how that impacts the menopause transition and cardiovascular health. So a lot of my research is looking at these different factors across life, how they impact what's going on during the menopause transition and cardiovascular health. What are interventions then? What are types of programs that we can do to improve cardiovascular health during this time period, so that then you can be set up for better health outcomes later in life? And then also, again, that trying to develop different educational tools or interventions, particularly among Latinas. And so also along with cardiovascular health, a lot of the changes in terms of like sleep and cognition, and how all these things are also related, that are going on during that time period. So I'm kind of
I love it. Like I'm sitting here, my mind is like, yo, what is right? Because science is my background too. So I'm just like, what research? But I love that you're looking at all the aspects, because sometimes people just focus on one lane, and it's like, no, it impacts the whole being, it impacts the whole body, the whole person. And rather that you hit something you said, even financially, your economical status, and all of these things, even unfortunately, those things outside of culture and different things, those things sometimes are biases, even in the healthcare field, of how someone is treated. Right. And it's so unfortunate, but I love that. And you all, cardiovascular health is so important, and being able to look at all of those different factors, it really gives an opportunity for a more holistic look of different things. Because if we know, most people, if you're having some financial difficulties, you're already stressed, right? you're already certain stressors and different things. So really teaching people, how can we learn to manage stress better? So we know within women of color, they typically say, oh, they experience menopause longer, earlier, harder, harsher symptoms, all of these things. But that broad spectrum of looking at I'll say every department, right, really can give, great insight into how that transition may look. Because at the end of the day, someone's socioeconomic status is not just going to automatically change because they're going through the menopausal transition or how they manage stress, right?
Yeah.
Like, and do you think some things are just embedded culturally? Like in the Latina culture, how is healthcare even viewed as a culture, just an overall view? Is it something that's talked about all the time?
This is also tricky because it's, again, when we talk about culture, we're never a homogenous group. We always have like this intersectionality of different identities that we have. So even within that, there'll be differences based on, were you born in the US, outside the US? How long have you been? Do you speak English or Spanish, or what country of origin? But a lot of the times, one of the things, if I think about my personal experience and what I've seen from a lot of my participants, so this is more like anecdotally, you're always, one of the cultural values is about you're kind of accepting, like, the doctor's or health provider is a figure of authority, so you kind of like respect the figure of authority. That's how, one of the things that of course was like ingrained in me, and and it is something like, if you look across, it's still like a cultural value, but again, it also shifts depending on other factors. But that is one thing that you'll see, that I'll continue to see among like midlife and older Latinas now. And so sometimes you kind of can see hesitation in terms of questioning the provider or asking certain questions. And if the provider doesn't bring something up, then you don't think it's important, so you might not bring it up. And that's what happens sometimes with menopause, where some participants, some of the women that I spoke to say that they don't bring it up. They expect the provider will, and if they don't, then they don't think it's something important to be discussed. So it is one of those things like shifting.
I can understand. I said I can definitely understand that though.
Yeah.
Because a lot of times, culturally for us, we don't talk about certain things, right? And like you said, the provider being an authoritative figure, so you kind of sometimes just take their word, right, with certain things without having a conversation, not a one-way street, but a two-way street conversation where you feel open enough to even ask questions without feeling like, okay, this is a dumb question. Or without making yourself feel like, okay, they're not going to listen to me. And so I love that you brought that up, because with women that I've talked to as well, that is one of the things, like, I don't want to sound stupid, or they're not going to listen to me anyway. And not that you have not potentially had providers make you feel like I'm the doctor. I know without really just saying, but I'm with me and my body all of it longer than I'm even going to be in this office, right? So I'm glad you brought that up. And because that is one of those pieces, that's a barrier that we're like, no, let's be empowered to advocate for ourselves, be empowered to ask questions, be empowered to speak up, be empowered to show up, whatever your cultural, is. I was talking to someone the other day and they were like, in their culture is just one of those things that you just be quiet, right? And I was just like, yeah, so I love that because it is something that needs to be addressed and talked about, and just giving people that you have the power to advocate for yourself.
And
Absolutely.
even going along with that, even if you have a list of the things you want to discuss, because of the time limit, you won't always get to discuss everything. But if you have like an ongoing list, then you make like an appointment for, okay, this is the thing I want. I'm asking questions about this time, and then next time it'll be this other issue that I'm having. Because especially during this time period, you're not just going through menopause. You might also now have like nuance at diabetes or your cholesterol or your blood pressure or different things. And so at each visit, if you have like 15, 20 minutes, you can only kind of focus on one thing is what
Yep. And so
providers do.
and then with that, you find that people won't keep going back based upon insurance, based upon finances. So even if some people want to go back, having to pay 25, 35, or whatever that copay is every single time, some
Yep.
people are just like, you know what? I'm gonna figure it out. We just gonna normalize this. And even if I may need something else, I'm just gonna wait to the next visit or something. So
Yep.
yeah, and you're right, that 15 or 20-minute time frame, I mean, it goes by so quickly, and it's just like, hey, but I have one more question. And they're like, yep, go make an appointment at the front. Or, okay, let me go up there and schedule another appointment within 3 months or within 6 months. And what I've seen with some, even at that 3 month, they're like, I feel fine, I'm not going back.
Yeah. Yeah.
Until maybe something arises, and then
Rises. That is, yep. That is
right. So that is really real. So before we head out and leave this amazing conversation, let everyone know anything that you're working on, how people can connect with you, support the mission, and different things that you're doing.
So I do have a website. I have to I'm not great about updating it as often as I should, but I feel like I did update it like 2 months ago. But it's cortezmenolab.com. And so on there, I tend to put there's some educational things there. There's also a section about research and different research projects that I'm working on now. And I try to put, results or different things about the research in there. Try to make some videos to make some things more accessible. But I think that's the best place to kind of get information on what I'm working on and contacting me through there. And if there's anything in there that's of interest to anyone, yeah, you can get a direct link and email me, and yeah.
Amazing. And so you all make sure you connect with her. This is amazing. We'll definitely have to have her scheduled for 2026 for our menopause monthly meetups, a Latina experience. Okay. And so just because we want women, we want communities and families to know that you're not alone, no matter where you are, whether you're in Iowa, Chicago, Georgia, there's resources and information where people are ready, and it's accessible, right? It's affordable, it's accessible. A lot of what we're doing, we're giving out free information, right? Free information, but ways that you can connect and work with Dr. Cortes. So look, any final words that you want to say to the world, right? Any words of encouragement or anything?
I mean, I'm just grateful for spaces like this now that we have, more generating more information, more conversation, just so that people get the information that they need in order to make better decisions about their care and to ask the questions that they need to ask in order to get the information and the care that they need. So thank you.
I'm here for it too. And you all, this is why we have healthy chats. Because first of all, I don't know everything, and my perspective is my perspective, right? But I've always loved to bring other perspectives and highlight men and women who are doing amazing things in their communities and reaching globally via social media and various platforms digitally. And so thank you for your time. I appreciate you. And I will be reaching out to you. You all heard it first. I will be reaching out to her to see about booking her for one of our menopause meetups for, I want to say 2026, because we're on a roll for this year, but absolutely, because I do believe women of color communities need more awareness initiatives. And I'm excited too, Dr. Cortes, that so much we're seeing more movement in the menopausal space. But you all, for those who've been doing it, keep doing what you're doing, because even the celebrities are not going to reach everyone. We all have a mission, we all have an assignment. And so make sure you're connected, because we are accessible. I'm just saying, we're accessible, and you still need to get on the calendar though, but we are accessible as well. So this has been another episode of Healthy Chats. Make sure, ladies, you rise and energize yourself and someone else with your smile, with a touch, with a hug, with positive words of encouragement. And most of all, your health is your wealth, and it should be a priority. So let's level up this year and beyond, and let's keep moving the needle when it comes to menopause and beyond, every aspect of your life. Talk to you all soon.